Pop quiz. The nurse is conducting a community health education session on preventative health care. Which of the following are examples of primary prevention measures? Select all that apply. All right, before we even get into select all that apply, let me make this clear. You absolutely need to know the difference between primary, secondary, and tertiary preventative care measures. So I want you to think about it this way. Primary, the patient doesn't have it, and we don't want them to have it. So we're going to do things such as teaching. We're going to give immunizations. We want to prevent the patient from having it. Secondary, the patient might have it. So we're doing early testing to see if they do have it and to see how bad it is. Tertiary, patients definitely got it, and we want to keep it from getting worse. Okay? Now let's go. Difference between primary, secondary, and tertiary. We're looking for primary preventative measures. 1, administering the influenza vaccine. Absolutely. Why? Why is that a primary? Remember, primary, the patient doesn't have it. We want to prevent them from having it. So we're going to do things, again, such as vaccinations and education. True. 2, performing a blood pressure screening at the local health fair. False. That's not primary. That's secondary. Why? We want to see if the patient has it, and if they do have it, how bad is it? That's secondary, not primary. 3, teaching adolescents about the dangers of smoking. True, that is primary. When it comes to education, when it comes to vaccinations, those are going to be primary. We don't want the patient to have it. We don't want the patient to do it, so we're going to teach them about it. We're going to give vaccinations. We're going to prevent. How about number 4, providing cardiac rehab for clients recovering from a heart attack? False. That's not primary. That's what? Tertiary. Patients already got it. They had the heart attack. We just want to prevent it from getting worse. Things such as rehab, physical therapy, occupational therapy, speech therapy. The patient already has whatever it is. We just want to prevent it from getting worse. That's going to be tertiary preventative measures. How about number 5, administering insulin to a patient newly diagnosed with diabetes? False. That's not primary, because remember, primary, the patient doesn't have it yet. This would be secondary, right? Patient already has diabetes. Giving them insulin, I just lied to you. No. Giving them insulin is tertiary because they already have it. We want to keep it from getting worse. So number 5 is tertiary. Number 6, encouraging physical exercise to prevent obesity. Primary. Why? You're teaching. They're not obese, but we want to prevent them from being obese. Okay? One more time. Primary is prevention. Vaccines, education. Tertiary is secondary is early detection. Things such as biopsies, colonoscopies, blood pressure clinics, right? We want to see if you have it, and if you have it, how bad is it? And then tertiary would be things such as rehab. You already got it. We just want to keep it from getting worse.